Hey everybody, Dr. Tucker here from Active Family and Sports Chiropractic. So, as most of you probably know, but maybe some of you don't know, I practice acupuncture. I've been practicing acupuncture here in Kingston for the last 5.5 years. It's been a real joy to provide this service to our community, as I believe it's probably never been practiced here before because we are in a bit of a rural community. But I want to start a series here on some of the top conditions that I see for acupuncture here in my office. Acupuncture is about 75% of what I do throughout the day. I also do still practice some chiropractic work, and I do a lot of nutrition work with my patients as well. So today, I don't have my glasses on because I'm going to be talking about headaches, and so I'm going to demonstrate some of the points that we can use to help with chronic headaches. So headaches, number one, are not normal. And if you have headaches, you should probably try to get down to the root cause of why you are having those headaches. They can be happening for many reasons. It can be something physical, something in the mechanics of the neck and the skull itself that can cause headaches to refer up. It can be chemical. It could be caused by some of the foods that you're eating or lack of foods that you're eating, a nutritional deficiency. Or it could be emotional and related to stress. No matter what the cause is, acupuncture is really effective at trying to manage headaches themselves and the occurrence and the frequency and the intensity that they occur. So I want to show you guys, using a little spring, some of the points that we commonly use for acupuncture. So this is actually called a teishin. I do provide these in my office to some of my patients to take them home and continue to stimulate certain points, depending on their condition, throughout their body that they can get to that can help to extend the relief that the acupuncture provides while they're here in the office. So this is just a little spring-loaded metallic device. If you don't have one of these, something around the house you can use to stimulate acupuncture points include maybe the end of some tweezers. So just a little point there. You can actually do it with something as simple as a fingernail tip. You can also use the end of like a ballpoint pen, obviously not the pen side, but the other side, just to get something that's sharp, but still a little bit blunt so it's not actually piercing the skin. So in my office, I do needling. The most common size needle right here, probably not going to be able to see it too well on the camera. That thick part down here, what you're seeing is the handle. The thin part is what we actually use for treatment, and depending on the area of the body we're going in, the angle, and the tissue that we're going in is going to depend on how deep they go in there. But some quick points for headaches. So headaches can occur on the vertex of the head, meaning the top of the head. They can occur on one side of the face or on the other side of the face. Sometimes people definitely say that they originate from the top of the neck and kind of wrap around the head. Sometimes they can be sinus related. But some of the acupuncture points we're going to go over are just general ones that will help. So one point that is actually not on the head that we use for acupuncture is this point right here. If you bring your thumb and your fingers together, where that crease lines up right there, that is called LI4, large intestine 4, and that is really powerful for pain relief, anything going on in the head and neck area. So that's when you want to stimulate. How we use this spring is we just place it on the point, and we're just going to bounce about 5 or 10 times, applying light pressure. And you know, it feels just like a little sting there, and so we want to stimulate that point to try to help with the pain relief. I almost always do all of my needling bilaterally. We want to stimulate both sides of the body and both sides of the brain whenever we're doing any acupuncture, and especially for pain relief. So along the lines of having a lot of tension in the neck, posture issues, if you sit a lot, you need to address your ergonomics and possibly also get under chiropractic care as well, because that can really try to help to balance all the muscle tension and everything that's going on posture wise in the body. So a couple other acupuncture points we use here in the office for headaches. Right along the hairline, right back here at the very top of the neck, we can also use this little thing here. If you feel that tension coming from back there, just right on that muscle there, and again, we would do both sides. There is a point back there that's actually called the sleep point, which people who are in chronic pain usually don't sleep very well either, so that point can be really powerful for just kind of like relaxing the entire body. Another one, a lot of people say to me that they hold their tension in their shoulders. So the point about halfway between the top of the shoulder and the base of the neck is a point along the gallbladder meridian. We're just going to bounce that a couple of times. And again, you don't have to have the spring, but it makes it a whole lot easier. You can stimulate these points with your nail or the end of tweezers or a pin or something else there. So another good thing, if you do have a sitting job, taking posture breaks throughout the day, we recommend people take breaks at least once an hour. Get up, walk around, take some deep breaths, get some fresh air. Try to just keep your body at rest overall with your ergonomics. So another point, actually a series of 3 points we're going to do right here in the top of the forehead, so right where the eyebrows end. And of course you want to be careful when using anything sharp near the eye. We're not going into the orbit at all itself. You just kind of want to feel that bony prominence right there at the end of the eyebrow, and we're just going to bounce on there for a couple seconds, both sides, and then right in between and up about an inch from the sort of bridge of the nose there. And that is actually called, in acupuncture they taught us it was called the interior magic threesome. So take what you want about those 3 points right there. Those are very, very powerful dealing with any sort of the sinus issues or headaches themselves. So those are some really quick points that we use for headaches. We actually do, I do quite a bit of needling down in the lower body as well for headaches, just trying to rid the body of any stress and tension. So we do a lot of needling in the feet itself, which obviously I'm not going to demonstrate here, but you can imagine what that probably looks like. People, ask, people come in, sometimes we always take their blood pressure, take their vitals first, and sometimes, people's blood pressure is a little bit high or their pulse is high, and I'm just really nervous, I'm really afraid of needles. Overall, acupuncture is typically very relaxing for people. The needles that I use are actually called painless needles or painless acupuncture because you feel that first little prick when it goes in, but you don't feel it the whole time. I leave needles in for about 20 to 25 minutes depending on what we're working on. Sometime we may do treatment on the front side of the body, take the needles out, and then flip you over and do treatment on the other side of the body as well, depending on what we're working on again. So, and the amount of needles that I use, probably not as many as you're used to seeing in the movies. I use somewhere between about 12 to 18 needles per session because we don't want to overwhelm the body and we really want to get down to what are going to be the most effective points for you when you're here for your acupuncture session. So I hope that was helpful. I hope you don't suffer from chronic headaches, but if you do, maybe you should have someone who practices acupuncture on your healthcare team, and of course a chiropractor as well. So if you ever have any questions, just shoot us a message and we will get back to you, and I hope you all enjoy this series I am going to be doing on acupuncture this month. See you later.